dentistry from the West Virginia University Medical School, dentistry school, homeopathic medicine, 1999 in Arizona. He also has a doctorate in osteopathy from Chicago College of Osteopathic Medicine. He also did an internship there. He has been since 1983 working in integrated medicine and traditional medicine. He's board certified in both of those disciplines in Arizona. He's always preferred natural medicine, but he's one of the natural medicine practitioners who's courageous enough to go back to traditional medicine when it's appropriate, something I very much appreciate. He's also an ordained minister, and he's a chaplain with Chaplains for Christ to the Nations out of Fargo, North Dakota. He's an assistant pastor at Desert Cathedral in Casa Grande, Arizona. He developed an interest in Lyme disease by virtue of having it himself. It nearly killed him. He was told that he would be paralyzed. As you can see, he's managed to overcome that. And so part of this lecture is going to be on how that happened. He's a founder of Project Exodus. He also has a new book coming out, which he's going to tell you more about. It's called Escape, a Workbook for Getting Free. And here is Dr. David Korn.
Thank you. Thank you, Mike. It's a great privilege to be here, and I am charged with a particular errand. One of my patients is a 92-year-old lady who is crazy about TeslaTech and the magazine, and so she says, be sure and bring back some neat stuff from this conference. So I'm going to be hanging out looking for those things that might excite her. So she is really someone who kind of motivates people, and still at 92, so there's always a chance for us. Tonight, we're going to be talking about what I like to say are the end-day diseases. In particular, I'm going to tell you about a disease that's so serious, if nothing else, I want you to know about it. I promise you, you have friends, neighbors, and possibly even yourself with Lyme disease. And Lyme disease is, in fact, a deadly illness. But let me just do a couple of things first. And I want to be sure that I have this clicker right. I'm very challenged technologically. Which one here? That one right there. Okay, very well. He told me that before, but of course I blew it. I would invite you to go to exodusdeliverance.com. That's very elementary at this point, but we are starting to develop our website, and it's all about deliverance, getting free from bondage, and bondage is anything that interferes with being all someone can be, spiritually and also in this world here. So I founded that in 1993, and with the Lord's help, and it's something I'm real excited about. It's probably my most favorite thing. And so we have an ongoing program, Project Exodus. This is the book that will be out. I'd hope to have some copies, some preliminary issues here at the conference, but I didn't make it, we didn't get it in time, and so we expect to be having that in the next 30 days. This is a workbook that's been coming to fruition for about 9 years, and we're really excited about it. We've been using it for a good while, and we've used it as in a pilot project. What happened was this. This wasn't something I wanted to get into, but we had, through a curious set of circumstances, I was involved in attending a program for addiction, and it was because I had a person in my office who was helping themselves to some of the class 2 things, and I was going through a divorce in those years, and I wasn't really watching the ship, and so they, after a great big long to-do, the people at the involved with the I guess it was the DEA, they said, well, we're going to have to do something with you. We know that you weren't selling drugs, you weren't taking them, but you know, we usually take a guy's ticket for this, and so I was pretty upset about it. But nevertheless, I had to go take these courses. I had to go take this 12-step program, and I wasn't too happy with it. And they don't let you speak unless you stand up and say, hello, I'm Dave, I'm an addict. And I wasn't an addict, so I didn't want to say that. Besides which, I think that as a man speaks, so is he in his heart. And at the end of each meeting, they would have you get together and say that you're powerless over our addiction. And I don't believe that when you speak such negative things, that you're ever going to get to the positive things. And so I wasn't too happy with it, and they wouldn't let me speak for the longest time. And then because I wouldn't introduce myself in that manner at the group. Now, understand, I'm not knocking the 12-step programs. They've done some really good things. But there are problems with addiction throughout the world in such that, as such, they're not obtaining deliverance on a permanent basis. There's so much relapse. And I had been working in brain chemistry for a long time at that point. And so, as it turned out, my dissatisfaction with that program led to the formation of this alternate program, in which we use neuronutrient precursor amino acids to help quench the craving that exists in the brain and in the reward center. It works really great, and it programs which use neuronutrients regardless of what steps they use. And we also developed a Christ-centered 7-step program. Regardless of what steps you use, if you use neuronutrients, you have a much, much less relapse rate. And so that program was established in '93, and we used it as a pilot project. And we said, okay, now we have some steps, a couple of men and myself, we had gotten the steps together, and we said, okay, now we've got the steps, but we don't have any neuronutrients and we don't have any funds. What are we going to do? And we prayed about it. And I don't know if any of you believe in prayer or not, and that's fine if you don't, but I do. And so we prayed about it, and you know, within a very short time, I got a phone call from a guy that I had lectured for on brain chemistry. And his company manufactured brain neuronutrients. And he said, you know, did you really, because I had told him if he ever had any neuronutrients that he didn't want to use or that were you know, surplus in his mind, please give me a call, we'll use them. And I didn't even have the program then, I had no idea of this, and that was several years earlier. Well, after that prayer and all, we finally got a telephone call from this guy, and he said, were you really serious? Did you want any neuronutrients that we might have for your use? And I said, absolutely. And I was real excited because, of course, this was an answer to our prayer. And I said, well, how do we get them? He said, bring a truck. I said, well, you know, I didn't want to say how many do you have and all that because I was excited to just have any. And he said, well, I said, what kind of a truck should we bring? He said, well, you better bring a very large truck. And we went up and we got $48,000 worth of free neuronutrients that we gave away in the program for about 3 or 4 years, and they were very effective. Unfortunately, we didn't keep statistics on that. I didn't have anybody that could do that, and we didn't know how to do it, but the program was very successful. And it led to this book, which is coming out here in a few weeks. So I just want you to know about it, and hopefully I have a tablet over there if you want to put your name and address down for any of our products. We do have some products that you might be interested in. A lot of information on natural health, and I didn't bring it with me, but if you would like to get on our mailing list, you'll get our newsletter, and you will be informed of a lot of the things that we're doing in alternative medicine. Okay, we have some definitions. I don't know what. No, okay, I know what. How do I get that to come down next?
Okay, push the button again. Try that left button. Hold this one.
Left button? Okay. Okay, all right. Definitions. It seems elementary, but we need a definition for disease. What is disease? And disease is a departure from normal. That's the one I like because it's simple. But it's much easier to remember then a condition of an organism that impairs normal physiologic functioning. That's a lot of words, but it does say it well. I still like departure from normal. Okay, the next slide is another set of definitions that we'll use tonight. Epidemiology. Now, epidemiology is a branch of medical science that deals with the incidence, distribution, and control of disease in a population. A study of the sum of all the factors controlling the presence or absence of a disease or a pathogen. Next, we've got some more definitions. What is a pathogen? It's a disease-causing organism. And we're going to talk about a very bad disease-causing organism that's really starting to get a lot of press right now, and it is the fastest growing epidemic in the world. It is in 6 continents. It is devastating our population, and we're going to talk about it in more detail. But I wanted you to know what a pathogen was. It's a disease-causing organism, such as a bacterium. Not all bacterium are pathogens. Now, maybe you knew that, but there are such things, for example, like good E. coli in your intestine. Not all of them are bad, but there are bad E. coli as well, ones that cause terrible diarrhea and sickness. The study of disease, then, is pathology. And pathogenesis means a study of the origins of a particular disease, especially the causes. Another set of definitions. Sorry to bore you with these, but they're always important for the basis of our discussion. Epidemic is a contagious disease that spreads rapidly among many individuals in an area. Endemic. Endemic means prevalent or peculiar to a particular locality or people. Pandemic. Now there's a good word because I hear it often. What does it mean? I didn't know. I had to look it up again. Prevalent among many individuals over a wide geographic area. So what you're talking about with a pandemic is you have a whole lot of people over a whole lot of area that are sick with a particular disease. And we have, believe me, a pandemic with Lyme disease. The problem is a lot of people don't know it. They've got a disease, they're not sure what, their doctors are not sure exactly. They tell them it's an autoimmune disorder. What is that? What causes it, doc? They'll ask. And the doc will say, if you really pin him down, he'll say, well, we're not really sure what causes it. And so I like to try to get an answer to what causes, sickness, so that I can then be able to think in terms of how I can treat it, how I can get healed from it. So I like very much to be able to try and figure out what causes things. But a lot of medicine does not have any clue what causes a lot of diseases. They'll give them fancy names, but the truth is, what causes it? Well, we're not sure. We think it's an autoimmune problem. Well, what is that, doc? Well, I had one. I had several, and they had no clue what I had. And a plague is what we're going to touch on. I wouldn't classify Lyme disease at this point as a plague, but it's so close, it could become one easily. How is that possible? Well, one of the treatments that we use for Lyme disease in our office, and I have 130 Lyme patients of record right now. I have 400 or 500 patients who are chronic fatigue patients or fibromyalgics. And I have most of the Lyme patients were, in fact, with other diagnoses, such as MS, Parkinson's disease, Alzheimer's, and a whole lot of them with rheumatoid arthritis and various other diseases. None of them had a diagnosis of Lyme disease when they walked into my office. They only knew that they were getting sicker and sicker and sicker, and no one could tell them what they truly had. It looked like the particular disease that they were given, the name for, but it didn't, the doctor admitted, well, maybe it's just not following the usual customary role of that particular disease. When you have something like that, or you have a loved one with that kind of a diagnosis, be aware that it could be Lyme disease, because it will not follow any particular, you can't actually say that it is exactly following a particular set of circumstances. Now, what was the bubonic plague? You probably all know about it. It's of historic interest. It started in China in the early 1330s, and I'm going to compare this so you'll understand why I'm doing this. It was China was in those days, like it is again today, a busy trading link to the entire then world. China exported more than goods, though, in the 1330s. It exported the Black Plague. They called it the Black Death. It began when some Italian merchant ships returned from the Black Sea, and which was a link to China. And by the time they had made Sicily, they had a boatload of dying people. These people had red spots all over their bodies, and these spots soon turned black. It was called the Bubonic Plague, and it killed with terrible speed. This guy, Boccaccio, was an Italian writer who wrote, "These people ate lunch with their friends and dinner with their ancestors in paradise." That's how fast it killed. Bodies literally piled up in homes where people were paralyzed with fear. No one would conduct funerals. No lawyers or doctors would come to the house to write up wills nor attend the sick and dying. Now, what I was telling you about is this particular method we have of treating Lyme disease involves injections of a very powerful penicillin shot, and you give them 3 shots a week for 8 weeks or 12. And one of the problems, all of a sudden, we're getting good results. And incidentally, we'll be publishing the results. We're having a very concise study of all 130 patients and what they had, what their other diagnoses were, how their treatment, and so forth. I think it'll help a lot to have that published. And I have people that come in and work on that only in my office. People were paralyzed with fear, and there was no one to come in and do the things that were necessary with the housekeeping of death. Well, when we suddenly got the message we can't get penicillin of the type we needed anywhere. Wait a minute, penicillin is it's like mold on cheese. It's in bread, it's in milk, it's in everything. So how could we not get it? Well, it just so happens they needed a whole bunch of it down in Louisiana. And they sent all of it down there, and there was none left over for the people with Lyme and other illnesses. And so we have not been able to get it now for about 6 weeks. There just is none around. So 5 years later, in Europe, 25 million people were dead. And 1/3 of the entire population of Europe gone. It really altered the entire country. Now, this is what did it. And this little bug here, I don't know if you can see there, but yeah, you can see it. The little paper clip, it looks like a pin, safety pin. You see that? These are red blood cells here, stacked up red blood cells. There's a white blood cell, and there is a little tiny safety pin-like bacterium called Yersinia pestis. That is the agent of bubonic plague. It's amazing that something that small can do that much killing. Now, it was carried by this. This ugly guy here is a flea, and it is a rat flea. Now, the actual size of it is about, I think, 3 millimeters. And there it is. It's engorged with blood of a rat or possibly a human. And this blood was carried, and it also had a load of Yersinia pestis in it also. what happened was the rat flea would go from rat to human and from human to human, and the disease flared in the spring, diminished in the winter when fleas are dormant. And so what they would get would be an innocuous, seemingly innocent bite from a flea. You ever had a flea bite? Not a big deal, you think. But this young man here had a ulceration that developed, and then it became painful, and he's not a happy camper. And then, this isn't the same guy, of course, but it developed into this mass in the lymph nodes. And this is called the buboes. And these buboes were the name for, that's where it got its name. So this would soon lead to death if they didn't have antibiotics. This picture is more modern. So this person, many of them in the 1300s didn't live long enough to reach this point. That's how rapidly it went through them. But, you know, they didn't have antibiotics. And if we suddenly wouldn't have antibiotics to treat Lyme disease, we've become so complacent. We believe our supply of medicines is just going to go on and on endlessly. No sweat. We have plenty of penicillin, right? Well, all of a sudden we don't. And it's beginning to get a little concerning to me. Okay. The impact of the plague on European population. Take a look at this. In 1,000, there's 38 million. In 1,100, there's 48 million. 1,200, 59 million population in Europe. 1,300, it went to 70 million, about an increase of 10 million in each one of these centuries. And then 1347, it had stopped, and you began to see the trend. And now look what happened in 1352. 50 million. That 25 million showed up at this point. It was so bad that they didn't have enough workers to do all the worker things. And so these workers were told to go do their work, and they suddenly said, no, we're not doing that work anymore. We're not in that business anymore. Of course, we could maybe do it for double our salary. And it became then a feudal war with the lords, and it really impacted the whole social structure of Europe during that time. The plague is caused by a bacterium. Lyme disease is caused by a bacterium. Lyme disease is caused by a spirochete. What is a spirochete? A spirochete is a little twisted bug that has a spiral-like configuration, and it is of the same order as syphilis. Now, back when I was a young intern, eons ago, we had to give every person that came into the hospital, no matter what their disease was or what their symptoms were, every one of them had to have a test for syphilis. Why? Because it was the great mimicker. It mimicked every other disease. And so when you went to get a marriage certificate in those days, you had to have a test for syphilis first. Well, that went on, and then it kind of passed out. But now it's big brother, and I say big, it's younger brother, and he says, I'm back, and it is the spirochete of Lyme disease, and it is a very powerful agent. It's a slightly larger structure than the syphilis spirochete. And when I say older brother, it's just that we seem to have just learned about it, but it's been around a long, long time. In fact, it's been causing deaths that were signed off as other things for many, many years. It's been being missed in every quarter. Now, excuse the little misspelling there. Haste makes waste, doesn't it? Both carried by an arthropod vector, and that vector, in the case of plague, is a rat flea. In the sense of the Lyme disease, it's a tick, but it isn't just a tick. I want you to know that. Because people say, okay, this is not a problem in, for example, where I live in the valley of Arizona. People believe it's not a problem, and the doctors believe it's not a problem here. We don't have any ticks. Well, first of all, that's absolutely not so. We have tons of ticks. But first, they used to think it was just the deer tick. Well, then they realized it wasn't just the deer tick, and studies led to the fact that it's all ticks. And then they realized that the epidemic was going way too fast for it just to be ticks. And then they started testing other insects, and they found that it was mosquitoes, horseflies, dust mites, and fleas. There's that flea again. Now, it is delivered to the host by a bite with infected saliva. And the way that the rat flea gave plague to a victim was the bacteria that occurred in the flea made it have a gastrointestinal blockage. And so, because it wasn't able to get any nutrients, and fleas are carnivores, you never think of that, but they are, and because it was unable to get any food, it was horribly hungry. And so it would perch on its victim and just tear into it voraciously, and actually couldn't swallow, so it would throw up, and all the additional bacteria in the vomit would flood the open wound that it had inflicted with the bite. Both of these diseases are deadly. Plague is swift and deadly, and Lyme disease is just getting warmed up. Okay. Now on 6 continents, and here's how bad it is. They estimate that 50% of all chronically ill people have Lyme disease. That may be preposterous, but trust me. We've got 130 positive patients. We have administered 260 some tests to get those 130 positives. And those were all just chronically ill people, some of whom not very sick, but their disease didn't act like it should have acted. It didn't respond, and it seemed to get worse. The symptoms are just myriad, any symptom that you could think of. But the most common symptoms are, 1, fatigue, and all of a sudden the person their energetics just are not there. They're just tired all the time. Second thing that we see is a very severe, profound sleep disturbance. And the third thing is pain in the joints. Neuropathy, pain, nerve pain, and that's the worst. And we have all sorts and variations of symptoms that appear besides that. And we have, I think it's a 60-question interrogatory we ask patients who come in. And I am amazed at how many symptoms they are that are so common with Lyme that are just kind of blown off by the medical establishment and often by the patient and by their families. One very important symptom is dizziness. Oh, it's just a little vertigo. Well, it's probably from having to stand up too quickly from a seated position, or maybe your blood pressure drops, or perhaps you have a little blood sugar variation that goes a little too low, or, well, we're just not sure. But you have vertigo, and, we don't know what causes it, but take this pill. And so they'll often give antivert for it. It's called, in its worst form, acute labyrinthitis. And they believe that the vestibular portion of the middle ear is involved. That's the balance center. And I can tell you, when that's involved, you really have got a problem. Probably most of you may not remember John Glenn, who was an astronaut, but when he was running for some office right at first, when he first was running for an office. He hit the wall one day. All of a sudden, he had violent spinning and sick at his stomach, and he just couldn't walk and stand up, and he smashed into the wall. Well, I found out what it was like to feel like that. I was best man in a wedding, and both of the people getting married had been graduates from our program of Project Exodus, and I had the rings in my hand, and I'm standing in my pocket, and I'm standing there, and all of a sudden I had the most violent spinning in my mind, and I got so sick at my stomach, and I knew I could not stand up very much longer. And so I just prayed, dear God, don't let me go down before I get the rings passed off. And so I was able, with a great difficulty, to hold on to the rings and pass them over to the bridegroom. But then quickly I went over and passed out, and you talk about busting up a wedding with the ambulance and all that stuff. It was kind of embarrassing. But I had to go to the hospital for like 5 days. They had to actually teach me to walk again. And I said, doctor, what is the cause of this? Vertigo or labyrinthitis that I have. And he went, well, Dave, we're not really sure. We're not really sure. We think maybe it's a virus or something like that. Now, there's another, I'll just mention a few other things. There's a situation called Bell's palsy, where your face just shrinks, just shrivels on one side, and suddenly you can't, looks like you've had a stroke, and people are frightened that they might have had a stroke at first. What's the cause of that? Seventh nerve palsy of the face. They have no clue. We don't know what causes it, but, well, we're not sure, and we just hope it won't be permanent. We'll send you to the physical therapist, and they'll massage your muscles and kind of keep you going. And so we hope that then you don't have any disfigurement afterwards. What's the cause? Well, it's Lyme disease. We see that so often in Lyme disease. We see another thing that besides vertigo and seventh nerve palsies and TMJ and on and on and on and on. And so there's starting to be tip-offs, and we're beginning to get a handle on this thing, at least in our office. Now, what's an arthropod? An arthropod is a very hideous little creature. It's an invertebrate, and it's got, it includes insects and crustaceans, some of that lobster you really enjoy, or crab. I looked at those again after looking at the dust mite, a blow-up of what a dust mite looks like. Looked exactly like a crab that I used to enjoy eating. But anyway, they have a segmented body and jointed limbs. Vector, what's that word mean? Vector is an organism that carries pathogens. Remember what a pathogen is? A disease-causing organism. An organism that carries pathogens from one host to another. That's a vector. So you can use that term and freak out somebody when you say, oh, looks like, and you see a fly flying around, and, wow, it's a vector. Okay, more. Xenopsula chepsis, that's the name of the rat flea, and you saw earlier that it had, but it is an arthropod, and we kind of discussed this earlier, and that was about the fact that the GI tract was blocked off. But here's our friend, the tick. That has gotten a whole lot more reputation than it deserves, because it is the deer tick, I might add. This is the female deer tick. Of course, you guys knew it was a female, right? Not a male. Anyway, this is the female deer tick. I think you pronounce it Ixodes scapularis. We probably have some entomologists here who know exactly how to, pronounce that. But anyway, this guy here causes some terrible diseases also. But it is not the only thing that causes Lyme disease. All ticks can carry Borrelia burgdorferi, but get an idea what that looks like. They hang on trees. They hang on tall pine trees. And in Arizona, if you go up above what's called the Mogollon Rim, you have like another country, more or less. It's a whole different climate, a whole different set of situations. You have tall pines there and not so much desert. And we have just all kinds of ticks that hang on trees, just waiting for a warm-blooded animal or human to walk by, and they'll drop into your hair and then grab a hold. This is our friend the dust mite. Look at this pretty face thing. Wow, how nice. Now, that's a frontal view. And here's an aerial view of dust mites. Look at those guys. A dust mite is 0.03 millimeters. Now, that is about as small as you can possibly see something with the naked eye. And to think that it carries a terrible disease when you can barely see them. Now, the mite droppings are the things that cause it's a serious cause of asthma and allergies. And it lives on dust and skin particles, skin dust, you might say, that comes from our bodies. They live in human houses, and they also carry Borrelia Burgdorferi. Now, in the Bible, we've got the 4 horsemen of the apocalypse. And for the article about Lyme disease in the issue of the excellent magazine that you guys publish, I wrote an article about Lyme disease. And the person who drew the 4 horsemen of the apocalypse, they were so kind to let Steve use that on the cover. And they had the 4 horsemen on the cover. And and it says, I saw and behold a white horse, and this is the first horse, and he that sat upon him had a bow, and a crown was given unto him, and he went forth conquering and to conquer. This is in Revelation 6:2 in the Bible. All right. Now, this is the second horseman. And there went out another horse, the second horse, that was red. And power was given to him that sat thereon to take peace from the earth, and that they should kill one another. And there was given unto him a great sword. Well, wars and rumors of wars, Jesus said about it. He said that you will hear wars and rumors of wars, but be not afraid, for these times are not, the end is not yet. Well, it's close. We certainly hear wars and rumors of wars all the time. So, now, and I looked and beheld the 4th horse. And I looked and beheld a pale horse. And his name that sat on him was Death. And hell followed with him. And power was given unto them over the 4th part of the earth, to kill with sword and with hunger and with death and with the beasts of the earth. Revelation 6:8. Well, maybe that was written for the people in 1300. Why is that not the case? Well, Bible scholars believe that Jesus, in predicting the time of the end, that and the earth is not going to go away, the earth is just going to be changed. Jesus was referring to a time which started, the clock for the 70 weeks of Daniel began to tick when, in fact, when Israel was made a country in 1948. And so then everything that happens after that is important to fit into these prophecies. So, what does it mean? Another definition at this point. Pestilence. What is a pestilence? A fatal epidemic disease, especially bubonic plague. Well, I've already told you that Lyme disease is not exactly a plague because it's not just ripping through the world, causing rapid death. It is causing death, but it's subtle. It's not like plague with bodies stacked up in a house. That's the only reason people aren't talking about it even more. But it is, folks, it is a plague. It is a pestilence. And it will eventually be able to fill that description. And Jesus said there would be pestilences. Lyme disease is a fatal epidemic disease. Like bubonic plague, it is spread by arthropod vector, tick, mosquito, flea, horsefly, and a mite. It is an infection. The spirochete, Borrelia burgdorferi. Now let me tell you about that spirochete again. The spirochete, and don't think that the bite is the only way you can get this disease. We have many adults who are sitting, let me put it another way. Some of you, the ages of you do not preclude the fact that you may have been born to a mother with Lyme disease. And if you're sick now, that may have been the cause of your Lyme disease. The oldest patient we have who had the longest Lyme disease in our practice was a lady who got it when she was 13, she believes. Her mother picked off a whole lot of ticks from her ear, and when she was 13, she says that she was sick from the age of 13 until the day she walked into our office at age 70. And we did the blood test, and sure enough, she had Lyme disease, and we then treated her, and she is completely well today. And unfortunately, she went through all of those years sick all the time. Different sicknesses, different symptoms, but always not being able to rise up to the level of being the best that she can be. And she coped well, she overcame, and she did real well for someone that was sick all the time. The spirochete Borrelia burgdorferi may not appear to work as fast as Yersinia pestis, but is far more subtle. And the thing about the spirochete of Lyme disease is it is made in such a manner that it can twist into any organ or system that it wants to because of its design. And then if you bring into its environment any stress, i.e. treatment of the Lyme disease, or much in the way of causing it to be, because it has your body, it believes that I don't mean to say it has a brain, but it really seems to have a mind of its own often. And so what will happen is it seems to be, in it, as things would seem, that it's in control of your body. And then all of a sudden, you start treating it, and somebody, disrupts its world, shakes its world by giving some proper antibiotics. And all of a sudden, this bacterium has a third life form that it goes into, and I like to think of it, it's almost like it just goes like this and curls up in a ball and says, oh no, you're not going to get me. And it becomes like a parasite. And all of a sudden, the antibiotics, which were so effective before, cannot touch it. So you have to switch to another antibiotic, and it has to be like Flagyl. Some of the ladies in the audience may have taken Flagyl at some time for a vaginitis, but it is a drug that is able to kill the Borrelia burgdorferi in its parasitic life form. It has 3 life forms. 2 of them are standard spirochetal life forms. The third is the parasitic form. Very difficult to get it in the bloodstream, to get into it. And then there is another scary thing that's coming forth, and there are researchers that are saying that it appears that this bacterium can actually undergo translation. It can actually change its DNA. Well, we'll never be able to get a vaccine or anything for a bacterium that changes its DNA. And so that's pretty scary. Okay. And the bacterium of Borrelia burgdorferi, it is motile. It can move pretty fast. So it can move in and out of organs, of tissues, and the tissue that it goes into gives it the symptoms that characterize that particular sickness. So if it's the heart, the patient may be troubled with heart palpitations or arrhythmia. And if someone has an unknown or undiagnosed heart problem that comes and goes like an arrhythmia and nobody can figure it out, you might think about getting a Lyme test. Now, a word about Lyme testing. Lyme blood tests are called Western blot, IgG, and IgM tests. And when they are positive, it means you definitely have the disease. When it's negative, doesn't mean you don't. If that sounds like double talk, let me explain. There are many, many cases wherein the patient can't muster the immune response necessary to demonstrate a positive result. And so the doctor then has to go on the basis of clinical presentation. Do they look like a Lyme case? Are the symptoms consistent with Lyme? And then there are hopefully some new tests, thank you, that are coming forward that will enable us to do a little bit better. But so far, it's the best test available, and it's better than the test they were formerly using, because that test was only effective in 65% of the cases. And so they were missing the boat, even if they did a test. Excuse me. The other part of that whole thing is that the test should be done at a specific laboratory, a laboratory at which they do Lyme testing, specialized laboratory. For example, I send all my samples to IGENX Laboratory, IGENEX, in Palo Alto, California. And they do a Lyme IgG and IgM test that will take 3 weeks to get the results back to me, and they are the best. So I use them, and I'm very happy with them. And they're very helpful in contributing to the research of Lyme. And so I am very happy with using that lab for my Lyme testing. The other laboratories that doctors use are very, very inadequate. The little hospital lab, or even the big hospital lab that a doctor uses for a case of, for example, a lady on the plane was talking to me about some of these autoimmune disorders. And she was talking about her daughter having gotten a disease of lupus, a diagnosis of lupus. And in fact, she said it wasn't just really like the usual lupus, the doctor said. Now, if you had talked that doctor into even getting a Lyme test, because what they would generally say back in Arizona, oh, we don't have ticks there. We don't need to do that test. Or if they did it, they would send it off to the local lab. And the local lab has no clue on how to do a proper Western blot test. And so the test would come back negative. And they go, see, you don't have Lyme disease, and that's it. Well, they did another study, and I don't have documentation of this, so please don't hold me to this. This was my colleague, Ellie Evans, who's an RN. She's an RN midwife. Ellie came to me with Lyme disease, very, very bad, didn't know it. But she was sick, had to give up doing midwifery, and she was just basically an invalid. And she had lost a lot of weight. She was down to about 98 or 100 pounds. And she's about 5'7", so she was quite thin. We did a Lyme test, and she was positive. We treated her. You have to put a port in. The best treatment for Lyme disease is intravenous antibiotics of the proper type. Now, I'm working on and studying a lot of alternative therapies, but I'm not able to say, gee, that's good now. And So we first have to get the load of bacterium down and hopefully killed completely, but that's not often. So we give antibiotics IV, which gives about a 96 to 97% success rate. And then the patient has other things that we do to rebuild their immune system. And I noticed on the way over here from my hotel, there was a little, well, it's not a real little building, but it's a smaller type corporate building, and it said For Life on it. And that For Life company makes the finest transfer factor I've ever seen. And that's a product that's derived essentially from mother's milk. And we rebuild immune systems with that agent, and very effective. And I've had cancer patients that had a lady completely filled with cancer, endometrial cancer. And we put her on just nutrients rather, not neuro, but just nutrients. And on her birthday, about 9 months later, the same doctor reported her CAT scan, the same radiologist, and she is 100% completely free of cancer. So some of these things can happen with nutrients. She's also a pastor's wife, and she prayed real strong, and we prayed with her, and it has a very important role in treatment. Now, that particular thing we use very much in our treatment to support the immune system and stimulate it. Interestingly, there's another company that's right here in Salt Lake City, and it's called the Pharmanex Company. And Pharmanex is a division of New Skin International. Maybe you've heard of them. Well, a while back, the University of Utah developed it was a rather large, high-tech machine that was able to determine the free radical pathology by numbers in a particular disease and in a particular person. And so finally they skimmed it down to the size of it could fit on this desktop now. And so University of Utah, having finished with their studies on macular degeneration, I understand at least that this was the case, and they then put this technology up for sale. And New Skin paid $50 million for the technology. And so they have the scanner, they have all rights to it. I have one in my office, but I'll never own it. I only have the right to lease it. And so the patient comes in and places their hand on the scanner, and for 4 minutes, we check their carotenoid level in their subcuticular skin. They get a number that puts them in one of 5 categories among people that have been tested. And the number, if it's real low, I think right away of cancer, Lyme disease. If I have someone who has a degenerative brain disease, I know that we can help them a great deal by giving them neuronutrients and giving them things to quench their free radicals. In other words, it points out someone who has free radical excess. And free radicals, I hope most of you know what those are. There's probably biochemists that could lecture on it here in the audience for weeks. But at any rate, and incidentally, I'm impressed with the level of knowledge and the search for truth that I have found among people that are part of this organization. It's very impressive to me because I am a seeker of truth also. And I get burnt by it sometimes because I'm controversial and I'm under attack most of the time by the medical societies. And so it's, and especially because I'm a Christian and a pastor, I get a lot of attack. But my hat's off to you guys. You're doing some fantastic work. Any rate, this Pharmanex company will lease the scanner to doctors who meet certain requirements. You sell a lot of the product. And then you get an idea by taking the numbers. Everyone, well, not everyone, but most of the people with Lyme disease are hitting rock bottom because their immune system is really wiped out. And then they get a second infection on top of the Lyme. It's called a co-infection. And the co-infection is usually most often a herpes family infection. And once again, this is not necessarily the sexually transmitted herpes that people talk about, but rather is a part of that same family. And so we see people with Lyme generally have episodes of herpes zoster or shingles at some point. And when they have a history of shingles and they present with fatigue and sleep problems, and they have a variety of other symptoms that fit with Lyme, we definitely do the blood test. Incidentally, the blood test costs $200, and it takes 3 weeks to get it back. So the other thing is we're developing some, when I say we, the doctors interested in Lyme are developing some other tests that are promising, but they're not really perfected at this time. So at this point, we're still depending upon the Western blot, IgG and IgM, but very strongly on the clinical presentation that patients have. And so that is most important. Let's see what we are here. So Lyme disease is like the bubonic plague in as much as it is spread by an arthropod vector, a tick, mosquito, flea, horsefly, or mite. It is an infection, and the Spirochete, Borrelia, Burgdorferi is the hombre. Okay, Lyme disease is a silent killer. I think I've already touched on this, but here's what I want to say. It remains latent in your body for years. Now, I almost died with Lyme disease, and my problems more or less started with that dizzy spell I told you about. And then I had a couple other, and I was admitted urgently to the hospital for heart rate that was 38 and chest pain. They thought I was having a heart attack. And they ended up doing an angiogram, which I didn't like, but I was so sick I didn't care. And then what happened was they began to investigate my problems, and they couldn't figure it out. And right after the angiogram, I started having pain in the bottoms of my feet. So another symptom is pain or tenderness or hypersensitivity of the skin of the feet. And so I started having about a quarter-sized area of pain in the bottom of my foot. And I asked the nurse, because I was still in the hospital, I asked the nurse, I said, please send me some ibuprofen. I've got some bad pain in my feet. And they did, and they brought it in, and it helped. But then it got worse, and it's about a $50 size. And by then I called my doctors and had them come to the bedside, and I said, what'd you guys do to me in that catheterization? I mean, I'm just really hurting. My feet are awful. And I'd had a spinal fusion years before, and I thought maybe that they'd twisted my spine when they knocked me out and did the cath. And it didn't turn out that they denied that, and I believe them, of course, now, but I didn't know at the time. Well, by the next day, I was screaming. And folks, I'm not ashamed to tell you, I was screaming and crying in pain. And I was pacing the floor. And I have never, and if you'll see me, I'm not drunk, honestly. I stumble a little bit now because my balance is bad because the feet don't have the same proprioception that they used to. But anyway, the pain was so severe that I knew that I couldn't live much longer if I was going to have this kind of pain. So I ended up finally finding I went to University of Arizona. I went to Barrow's Neurologic Center. I went to a neurosurgeon at UCLA who said, well, we don't know, I don't know what it is exactly, but you need an operation. I said, oh, I see. Well, I don't really understand. And I was desperate. I'd almost taken an operation hoping I'd maybe go to sleep in the middle of the surgery for good. That's how bad it was. And so they were going to do it. He was going to do a 10-hour operation on the cervical spinal cord. I said, well, how is that going to hurt? help the pain in my feet. And no one knew. And I went to just doctor after doctor and center after center, and not one place had any clue as to what I had. And not a one of them took a Lyme test. Not one doctor. And I must have gone through 30 different doctors, and I got the best ones that I could find. Of course, I knew most of them. They didn't have any idea. And they said, "We don't know, Dave, but it looks like your feet and legs, you've had 30 years of diabetes." And I said, "But of course, you see my record. I never had diabetes. And my feet and legs were fine before all this started." And they checked my circulation. The circulation was good, but it looked awful. And looked like it was curtains for yours truly, because I was going downhill fast. I lost 38 pounds. There was just seemed to be no hope for me. And by the time I reached the emergency room at the University of Arizona for about the third time, they looked at my situation. They said, "Dr. Korn, we're not sure what you have, we'll be honest, but you're going to be in a wheelchair, and you're going to have the rest of your life, and you're going to have to give your medical practice up right away." I said, "Well, that's a heck of a thing to tell a guy with something you don't even know what it is, And once again, they did not do a Lyme test. So I finally prayed a lot about it and whined and cried and everything else, many moments of tears. And finally, I went to a medical meeting that was held, that I'd always gone to every year. It was held by a conference. It's a company called Hemex.com, and you ought to look up their website. They are probably the leaders in the world on hematological evaluation, bloodstream and blood problems. And chronic disease problems is what they teach on. And they bring the best doctors in from all over the place. I even was asked to talk a little bit this last time. But prior to that, about 3 years ago, I, made myself go to this conference. And on the second day, Dr. Charles Christ comes right out of the box and talks about Lyme disease. He's a Lyme specialist from Missouri, Springfield, Missouri, and one of the nicest people you'll ever want to meet. And that man never failed to return my call, and he gets 170 phone calls and faxes a day. And he is an amazing guy. That's how serious Lyme disease is in Missouri. Well, Dr. Chris lectured on Lyme disease, and I'm sitting there and I went, "Holy cow, not only do I have that, I have lots of patients with it too that I've missed." And in fact, I went back, I then mentored with Dr. Christ for quite some time, and he long distance took care of my case because nobody else could do it. And the situation was I had to get a port put in because I had to have 500 milligrams of an antibiotic called Primaxin every 8 hours around the clock, and that would have amounted to 90 IV sticks in 30 days. Nobody has the veins for that. So they put a port in, and the port is connected to a little disc here, and it is, the nurse can always find the bloodstream, and the only thing is always have them spray a freezing thing on because your skin is over top of it, and it's innervated with nerves, and that needle goes right in, and they're in the bloodstream, and then you can administer your own antibiotics. And it's really, now, the thing that people have when they take the antibiotics, if it's successful, how am I doing on time? Terrible.
You got about 12 minutes.
Okay, I'll wrap this up quickly. The thing that you must know about this is that when you take the antibiotic, it is if it's successful, it's going to make you feel worse. Isn't that great? But it is. It's called a Herxheimer reaction. And it's from the fact that the die-off of the bugs that you kill ruptures the cell wall, and the cell wall pours out all these toxins. Magnify that times millions, and you understand all the toxins that you have in your body. And so there's what we call a Herxheimer's reaction. So patients will call me up and they'll say, Doc, you know, that those antibiotics you gave me, they're awful. They're causing me to have more fatigue, and I've had leg pain, and I've got numbness in my feet and my hands, and they go on and on. I said, you know what? Good. And then after they curse me, you know, I say, now wait a minute. It's only good because we're successful in killing bacteria, and that's what you want to do. Well, what we will do then is we will put them on either more pain medicines, or we will reduce their dose for a short time while we kill more of these bugs. And then you've got to concern yourself with the viruses that they have, because one of the viruses, human herpes virus type 6, is, in fact, has a government patent, believe it or not. It's U.S. Department of Defense. And it has, in fact, it is a brain virus. And it lives in the bone marrow as one of the herpes viruses that we treat, and successfully, I might add. And it mobilizes via the bloodstream into the central nervous system, where it causes demyelination. Now, demyelination is what is active in ALS, amyotrophic lateral sclerosis, Lou Gehrig's disease, and or MS. And they believe now, they're not sure, but they believe Lyme bacteria itself may also demyelinate. So when you can catch someone early with that, with an MRI or whatever, you can help them greatly by treating both of those things. And so I've got a lot more to tell you, but you know, it's time to quit. You've been a great audience. You've been patient with me, and I appreciate it. The facts are that this disease is awful. It's running rampant in our country and in our society. We've got to step up and let people know about it and get the doctors to understand it and look for it, because it is a way to stop. When I have a patient that is in a wheelchair and we can put them out of the wheelchair. When I have patients that have a fatal disease like scleroderma, I don't know if you know what that is, but it's a uniformly fatal autoimmune disorder where the organs are covered with epidermis, and the epidermis gets real hardened, and they can't move their fingers or their hands, and they can't walk, and it's deadly. And I have a patient that came over from way far away in Arizona, and she's completely well now. The university rheumatologist that took care of her was angry with her because she was getting treated in an alternate way. He said, I am an authority of the world on scleroderma. I tell you, you will die from this disease. And her daughter, she has 5 or 6 daughters that she now flies around to be with. And the daughter said, but doctor, don't you see, she's so much better. And she did all your lung tests. She did better on. And so, you know, she couldn't understand it. That's the attitude of a lot of doctors about their arrogance, their diagnoses. And the Life Extension Foundation just published a statistic that worries me very much more than maybe even Lyme disease. And that's the fact that one of the worst epidemics we have is the fact that American medicine last year killed 800,000 people through mistakes, medicine mistakes, bad diagnoses, improper treatments. 800,000 people. And in Canada, they had a situation where the nurses and the doctors went on strike. It's a socialized system when you can do that. And during the 6 weeks or 8 weeks or whatever it was that the doctors and the nurses were on strike, their mortality rate went down. And they went back into practice, and it went right back up again. So it wasn't just a fluke. Anyway, thank you. You've been a great audience. I'd love to have a time to answer questions. I hope
Actually,
that
we
could do
have
that.
a few minutes. We have about 5 minutes for a
great.
question and answer.
Great. Can we turn on the lights?
I would request that for question and answer time, raise your hand. We'll try to get as many as possible. We've got about 6 minutes. We're going to take the first 3 minutes in the lower half, and then we're going to take the second 3 minutes in the upper half,
Great.
okay? So when I acknowledge you, I'll pass you the microphone. Make certain that everything you say is on the microphone, okay?
Does colloidal silver have a dent on it?
Colloidal silver is good for a lot of things, and I use a different type. I used to use mild silver protein, 400 parts per million IV, but we had way too much treatment reactions with it. We had shaking rigors with people, and I took it myself, had terrible ones. But we've now switched to a thing called Argentin 24, I believe, or 23, and silver is great, and we're expecting big things out of it, but it doesn't have the bad shaking chills associated with it.
Dr. Korn, I much appreciate your presentation. Thank you very much. Have you explored the use of any Rife-like technologies for treatment of Lyme?
You know, I was waiting for the but. I thank you very much, but. Anyway, yes, bioelectric medicine is fabulous, and that's one of the ways we get back. I didn't get a lot of time to talk about treatments, but one of the things I just took a course on laser detoxification, and where doctor wrote an article recently in your magazine about one of the bioelectric technologies, and it was good. It was well done, and I liked it because it is effective to restore ATP. So it is very effective, but I'm not sure by itself it brings a cure. It's got to be a part of a whole treatment plan. Yes. Anybody?
Right here, Dr. Korn. Would you make a comment on...
Where are you?
Right here.
Okay.
Would you make a comment on bird flu?
On what?
Bird flu.
Oh, bird flu, avian flu. I don't think avian flu is a end-time plague, but I'm wondering if it's even real, or if it's another thing generated by, if you go to, let me quickly say, if you go to a site called, let's see, it's called, it's an island. Anyway, I'll get that for you. I can't think of the name of it right now, but it is it's a place where they did the studies on right at the end of 1940 on Lyme disease, and they got a Nazi microbiologist who was named Traub. And Traub came to this country under Project Paperclip, which we paid Nazi criminals to come into our, on this island, Plum Island. And on Plum Island, they experimented with anti-biologic weapons and chemistry, and I believe they started Lyme disease. Now, did they start, or did somebody who's interested in that start avian flu? I don't know. But we use the same antiviral treatments that we would use for other things. I don't know yet. I hope to God that we are going to be able to handle it if it comes. Peroxide IV, oxidative therapies, Rife therapy, For Life's product, which is much preferred to me to a vaccine. You just take transfer factor plus 2 to 4 twice a day. It's a wonderful preventive tool and really stimulates your natural killer cells, and studies have documented how powerful it is against cancer, and it's really good against viruses as well. So that's all I can say. I'm sorry, I'm not very much help on this yet.
Dr. Korn, have you had any luck using a Royal Rife machine?
It's like the gentleman asked. I believe the Rife technology has great hope. We did use it. Sometimes it is effective in identifying.
What frequency did you use?
Oh, I couldn't tell you. I'm not even versed enough to begin to say that. So you got me. If you're looking for a Rife expert here, I'm not yet. But I will be, because we're just starting to incorporate bioelectric therapies into our practice. We're going to buy a couple of machines, we're hoping, in the fall.
411, 211?
Pardon?
The 411 or the 211?
You know, I'm not familiar with those numbers. I'm sorry. I don't know. It's a Rife machine, though.
Is
Yeah.
Raynaud's disease possibly related to Lyme disease?
Absolutely. Absolutely. Yep. We see it all the time.
My wife has it bad. She's out in the lobby.
Yeah. Because, see, they don't know what causes that. So now, be careful, though, because you go to an infectious disease doctor, they'll tell you they're not even going to look for anything if they don't see the wheal and flare of the rash of you know, that's the initial Lyme bite. And that is only seen in 20% of cases. So they're still back there looking for a rash, you know, from the bite. And joint pain, that's their idea of Lyme disease. But it's all the autoimmune problems that it brings is what's really the problem. And yes, it could be. Yeah, any other questions?
Yeah,
Quick.
Dr. Korn, did you ever read anything about Dr. Phil Callahan's work at the University of Florida on actually treating diseases and treating bird flu and various other different things with pyromagnetics and colloidal silver?
No, I have not. I'm not familiar with that. I'd love to have
He's
literature on that.
semi-retired now, but he wrote a book called Pyromagnetism. And what he's doing is treating the insect. And he's very, very successful with bird flu and a lot of the other things. But there isn't a lot of money to be made from it, and what he's doing is very cheap, so I doubt if it'll ever take hold.
Well, yeah, you know, because of the greed in the situation. But would you take it upon yourself to get me any information on that? I'd really appreciate it. Please do so. I'd be very grateful.
Pyromagnetism is unbelievable because he's treating the insects that are causing these diseases.
Okay. Wow, that would be awesome. Because we are filled with, you know, the disease that these insects carry. Yes.
Yes. Hello, Dr. Korn. I have a question. Have you heard about effective microorganisms? I know of Vinnie Pinto. He also got the disease of Lyme, and he used effective microorganisms, and he got completely cured. It's invented by a Japanese professor, Dr. Higa. Yeah. And so Vinnie Pinto used it. He got the disease of Lyme, and he's completely cured. So now he's devoting his whole life about informing people, researching about it. And so I can give you some information about it if you are interested.
Yeah, I'd love to have. That's the way I learn a lot, is when people bring me things like that.
It's an alternative for antibiotics, that there are negative microorganisms, and you try to kill them, but with effective microorganisms, then there are positive microorganisms also.
I don't doubt that that's effective, but right now we're having such great success in being able to kill this organism that it would be hard for me to stop using antibiotics. But we also have to use probiotics because we've got to build up the good bacteria.
Yes.
And so, but I'd really like to gradually get into that.
I will give you some information via email.
I'd really appreciate that. Thank you.
Thanks. Dr. Korn.
Yes.
Hyperbarics.
Oh, it's a great thing. We use all the oxidative therapies. We use peroxide IV. We use ozone IV. We use HBO a lot, and more now, in fact. HBO has a great role in the treatment of Lyme disease. We'd like to start being able to do a study on the use of the IV antibiotics in the presence of HBO. In other words, right in the chamber, to be giving them the antibiotics, because I think that we would probably be able to shorten greatly the treatment period.
Dr. Korn?
Yes.
I sure appreciate everything you said, but how do you get rid of these that you kill inside the body? What do you do to get rid of them once they're killed by your antibiotics? What do you do?
We're using a lot of detoxification methods. The one that we most commonly use now is coffee enemas. We use liver detoxification techniques, and we also colon therapy and colonics. But I took a course this last 2 weekends ago from Dr. Cowan, who is probably one of the leading guys in the world on detoxification and using laser. And I felt this is an area I really needed to improve my knowledge and my treatment. And so you're right, that is a big, big thing. Yes?
Dr. Korn, could you make an unofficial estimate as to what percentage of people with chronic fatigue and fibromyalgia might actually have Lyme disease?
Yeah, you're going to not like this, but it's I think it's 100%.
100%?
I think so.
You're probably right.
Close to it. Close to it. Because like I told you, I have most experience with chronic fatigue and fibromyalgia. The problem is a lot of times you can't muster the immune response to get the positive test. So you have to kind of have the guts to go ahead and treat.
Okay, we have one last question.
Okay.
Is it human to human infective?
Yes.
And how does the plague compare with AIDS in terms of world effect?
I think HIV is definitely one of the end-time plagues. Again, I think it was government started, but you know, that's just my own opinion. Now, the other question you asked was, oh yeah, human to human does definitely occur. It occurs from sexual intercourse and also from having a baby born to an infected mother through transplacental. And it doesn't do any good to do a C-section with an infected mother, because by that time the baby's already got it if he's going to get it or she's going to get it. So it's transplacental. Boy, that's a great question, and I really think that's something. See, I was already concerned about blood transfusions because of HHV6, human herpes virus type 6, which they don't check for. They have no way to check for it, apparently. Well, they could. But anyway, people, you know, get brain virus from that. Dr. Joseph Brewer, an infectious disease specialist in Kansas City, he did a study on MS in autopsy cases of MS, and he found 77.7% of them had HHV6 in massive amounts. So he concluded, and his group concluded, that that was the cause of MS. I think if they'd gone a little further, they would have found Lyme at the bottom of that heap, you know. So I think blood transfusion is absolutely going to, you know, I don't see any way that it couldn't be transmitted by that method. Good
Ladies
question.
and gentlemen, Dr. David Korn, here's his the cover of the Extraordinary Technology magazine with his 4 horsemen. I'm sorry it doesn't give him just due there. That's it. But those issues are still available. The back issues at the counter outside.
Are they?
Yes,
great.
They are available. Warm round of applause for David. Thank you very much.
Thanks.
Ladies and gentlemen, the social will be starting in just a few minutes at the Hampton Inn. Pizza and soda provided. Thank you very much.